everyone, it's your girl Nurse Leash and I am back with another video for you guys today. In today's video, I'll be showing you guys exactly what I bring to work with me. It's going to be more than just the regular stethoscope, pens, pencils, paper, more than that. It's going to be the little things that count for me. So if you're interested to see some more things that you could bring to work, other than the usual, just keep on watching. And if you're new, thank you guys so much for supporting me by clicking on this link. And don't forget to click on the subscription button down below, the post notification bell, and the thumbs up. That way you get notified every single time I post another hit video. This video is not in any particular order. Whatever I just pull, I'm just going to tell you guys what I have. So let's go with the obvious first. The obvious is a stethoscope. I always carry my own stethoscope. Number one, I hate using the unit stethoscope because everyone else uses it. So I just make sure I have my own. This is actually the Littman 3 quality stethoscope. I got it from when I was in nursing school and I treasure it because this was my very first stethoscope. So this is not going anywhere. For me, I don't like it. Ears, something about ears just get to me. So I just make sure I have my own in my bag. Next, you gotta have a lot of pens, you guys. I particularly like the pens that have the 4 colors in it, if you guys can see, because it just makes it so much easier to write. So that way you don't have to carry all these other pens. My second job, I paper chart. I know, old school over here, but since we paper chart, I have to make sure that I have working pens and a red pen so that way I could document correctly. Because nothing is worse than not having a pen and have to run all around the unit to find one. So another thing that I love to carry around with me, I've been doing this since I was in clinical, and it's a small notebook, especially during reports. Like I said, I work in a long-term care and a retirement home, so we don't have the report sheets like we do in the hospitals. We have to basically read off of the reports and know what we're doing. So I just like to keep my little notebook with me. Just make sure when you do have a notebook, you do not write your patient's name in the notebook. That is a HIPAA violation. Know that you don't violate anybody's privacy and you keep it with you at all times. Okay guys, I just switched the angle because I just thought it was a little bit too high and this looks much better. My next item that I have is blue light glasses. I love my blue light glasses. In my first job, I do chart on the computer, so I chart and document a lot. So my eyes do get tired because I come back home and study. I just bought myself blue light glasses, or blue blocking light glasses. I don't know, but they do help. I must admit, my headaches don't come out as often, and they're really cute. I do have a couple of them actually, and I just bought some more from Zillow. So if you guys are interested, just give me a thumbs up and write down in the comments below of where to get some really cute and stylish ones. But I do love my UV blocking light glasses. They really help. They're stylish. And especially being in front of a computer for 12 hours, you will need these guys. So this is a plus. I just thought these are really cute, so I'm just going to keep them on for a little bit longer. But what's next in my bag that I carry? Masks and sanitizer. Sometimes unit runs out of sanitizer, to be honest with you guys. So I just make sure I have my own just for backup, because lately you guys know that the healthcare system is on like a downward spiral, unfortunately. So you want to make sure that you have the masks and the sanitizer on you at all times, just for backup, just to make sure that everything is okay. So this next product, I personally like to keep it in my bag because all the dirt, all the coughing from the patients, all the germs that could accumulate on your skin, you just want to wipe it off sometimes, okay? So I do have cleansing wipes in my bag. This one is Cetaphil Gentle Skin Cleansing Cloth. You can get these from Walmart, Shoppers, any drugstore, and this one's from Equate. This is unscented. If you do have sensitive skin, this one might be good for you. But I just keep them in my bag just to wipe my face after each shift or even during my shift. This is something that I got from when I was in school and clinicals that I still use up to this day. And it's a pen light, you guys. When I'm on the unit, most times the pen light is always something that don't work on the unit. So what I do is I like to keep the pen light on me just in case I have a false risk patient. I just could automatically grab it from my pocket instead of running away. I'm not running away, child. Not running away, child. So what I do every morning, just make sure that it is working. There you go, it's working. They're really easy to get. You can get them off of Amazon for for like 10 bucks, I believe, or even cheaper than that. But they're really good, and to be honest with you, I had this for about 3 years and the battery still works. Okay, so that's dope. I like to have my AirPods and I like to have my chargeable battery, you guys. If you're working an overnight shift, nothing is worse than having no music and a dead phone, okay? You never know what could happen to you when you go home. Something could happen, so you want to make sure your phone is working. And your AirPods, you guys. Like, for me, I like to have one ear in and just have little like classical music playing or a podcast, something playing really low in my ears just to get me through that shift, because sometimes that shift could be very dead and very long, and everyone knows around that 2 or 3 o'clock time is when your body starts to shut down. So having music playing in your ears and having a full phone is a necessity for me. I said it. Okay, so this item right here, you guys, this item makes me so popular on the unit. It makes me popular among my friends, my family. It makes me the most loved one. And I want to share this with you guys because I find it's very important, especially for us women. So what I like to bring with me on the unit is a bag of feminine products. Okay? Feminine products to me are very, very important. If you guys do know me, like outside of YouTube, in every single bag I have and in my car and everywhere I go, there is feminine products for days, okay? So I like to carry different types, different sizes. More times than none, sometimes we as women know that the visitors like to come unexpected and we can't just like shut the door. We have to let them come in. So what I do is I just carry a bag of feminine products just to make sure, just in case somebody needs it, I have it and it's handy. And I recommend everyone do that because you never know what could happen. Life happens, accidents happen. So it's good to have a bag of feminine products. These next products that I'm going to show you guys, they help me with my headaches that I do get sometimes. And if you do take pills, then I recommend you have just a small bottle of ADVIL. To be honest with you guys, if you guys know me, I do not take pills. I just have them in my bag. But they're really good. Sometimes when I'm in a rut and my head is really hurts, I do pop one. But other than that, I don't take pills at all. I do have 2 essential oil bottles here, lavender and peppermint. Yes, lavender and peppermint. I do have them as well, and I do use them. What you could do is, because essential oils are very strong, you don't want to put a whole bunch. Just a drop and just put them on your temples and rub them in. And you guys, I'm telling you, it works. It works. It works. And also, you smell good on top of that. Who doesn't want to smell good, okay? I do bring my lip gloss or lip balm, cream, and my eyeglasses cleaner. When you wash your hands all the time and when you have sanitizer, your hands get really dry, especially in the webs of your finger. And that's not cute. I like my hands to be cute and clean and moisturized. So I just have a small bottle of cream. Also, my lips get really dry because I'm behind the mask. More times than none, I like to use my lip balm because the lip gloss is sticky and it sticks onto my mask, and I don't like that at all. And the glasses, because I'm always on and off in my hair like this, the oils get on this lens and then it gets really dirty and I can't see. So I just bring my lens cleaner. I do have like a travel size one, which is much smaller and much more convenient, and just clean my glasses every now and then. That's it. I'm all about oral care. I used to have braces or Invisaligns, so a lot of times when I eat, I have to make sure my mouth is clean before I put that plastic back in my mouth, because you guys know plastic, water, saliva, and heat it just screams bacteria and screams bad breath. Not over here, sis. So I make sure that I bring a little teeth cleaner, a pack of gum as well. And I just chew it every once in a while just to make sure my breath is fresh. Once I finish eating, I just clean my teeth, rinse it out, and I'm good to go. Now, last but not least, if you guys are interested in what shoes I wear for my shifts, you guys, I did post up a video on my nursing page. Make sure you guys check it out. But I'll show you guys what I use. I have 2 shoes. I'm going to go with my Crocs first. You guys, these are my work Crocs. We are not allowed to wear the ones with holes on them for obvious reasons. Say like your needle falls, there's a chance of it going and giving you a needle stick between your toes and stuff, and that's not cute. That's not good. So I actually got these from, I think they're called Crocs for work or something. And I only paid 30 bucks. 30, you guys. So you should definitely buy yourself some Crocs. They're super comfortable. They're easy slip-on, slip-off shoes. Especially if you just wanna wear something that's not too restricted of your foot. These are the shoes for you. But on my other job, because we're not allowed to wear Crocs on my other job, I do have my Asics gel shoes, you guys. These shoes, whew, they saved my life. I used to be wearing my Nikes, and my Nikes are bad. I do have my Asics gels, quantum gel shoes, and these bad boys serve me so good. They have the gel right here, which is really good, and inside they have like an arch for your instep, because I have flat feet. So if you guys can see it right here, it works perfectly for me. I love it, and those shoes I would wear for like 12 to 14 hours every single day if I could. That is the end of the video, you guys. Thank you so much for clicking on this link and supporting me. Again, hopefully you guys have some new ideas and what to put into your clinical or even work bag. But if you guys are going to clinicals, congratulations. Tag me. I want to see what you guys have in your clinicals bag. So just tag me with this name right here, and I will see, and I'll be so excited. I'm excited for you guys. You're almost there. Just push through. Again, my name is Nurse Leash, and thank you for supporting me on this channel, and I'll see you guys in the next hit video. Bye.